Welcome to the course, Shaken Baby Syndrome Prevention Training for Child Care Providers, brought to you by Networx LLC and the Children's Trust Fund. All babies cry, and it can be an irritating sound. This is nature's way of making sure infants get their needs met so they can survive. If crying was a pleasant sound, it would be easy to ignore. Babies are completely dependent on their caregivers for survival. It's normal for babies to cry, and babies will cry for many reasons. A baby might cry to let you know that he or she is hungry or thirsty, needs a diaper change, needs to be cuddled, doesn't feel well, or sleepy. A baby might cry to release tension. In addition, you can expect there to be times when a baby can't stop crying. A baby's crying can be very upsetting. It's important for you to understand what to expect in terms of infant crying and to plan in advance for how you will handle crying. As a professional child care provider, you also have an important role in teaching others. If a parent or other caregiver asks you about a baby's crying, you can share what you have learned in this course. From the moment that they are born, babies communicate as a means of getting their basic needs met by their caregivers. Because they don't have developed language skills, babies use the tool that they have. They cry. So, in reviewing the quotes from this slide, you can see that babies, just like older children, feel hungry. But when an older child is hungry, he might say, "What's for dinner? I'm starved." But a 2-month-old will simply cry. If they're uncomfortable, the older child might say, "I'm not wearing these dress pants. They're too tight." The baby will cry. If they're overstimulated, the child can say, "Leave me alone." The baby will cry. If they're understimulated, "I'm bored," the older child can say, but the baby will cry. And if they're fatigued, the child can say, "I have had a long day," but the baby will cry. A great deal of research has been done about infant crying to find out what can be considered normal. This diagram shows what is called the crying curve. It shows that crying normally starts to increase at about 2 weeks of age, peaks in intensity during the 2nd month, and has decreased a lot by the 4th or 5th month of life. Studies have found that the pattern and timing of infant crying is similar in many different circumstances, including colicky or fussy babies, which we will discuss in more details later, premature babies, their crying peaks about 6 weeks after their full-term due date, other cultures with different caregiving styles, even other mammals. Although the patterns and timing of crying is similar in different circumstances, there can be big differences in how much normal infants cry. As shown in the diagram, the average amount of crying is between 1 to 2 hours at the peak of crying, but some infants will cry less and some will cry more. The main point is that they all are normally developing infants. The period of purple crying. Dr. Ronald Barr, an expert on infant crying, refers to the stage of increased crying as the period of purple crying. His research has found that crying in the first months of life has the following characteristics. It has a peak pattern. As mentioned, crying starts to increase around 2 weeks, peaks in the 2nd month, and gradually decreases after that. It is unpredictable. Crying can start and stop unexpectedly for no apparent reason. It is resistant to soothing. Crying continues despite efforts to soothe the baby, even among babies with the very best parenting. The baby tends to have a pain-like face when crying. Healthy crying infants can look like they are in pain even if they are not. There are long bouts of crying that can go on for 30 to 40 minutes and longer. Crying occurs more in the afternoon and evening. So, if this is a description of normal crying, What is colic? The main symptom of colic is a lot of intense crying. In medical terms, the word colic suggests intestinal distress involving the bowels. The term suggests that a physical problem is causing the baby to cry. It is not known for sure what causes colic. It has never been shown that infants who cry a lot have something wrong with their bowels. Crying causes infants to swallow air, which they burp up or pass as wind. Because they strain and tighten their stomach muscles, this also forces air out of the rectum. In other words, it may be that crying causes gas rather than the other way around. Is the baby in pain? When a baby draws up his legs, contorts his face, and screams, he certainly looks like he's in pain. Research that compared colicky infants to normal infants did not find any differences in terms of heart rate or the level of stress hormones that indicate pain. It is now believed that just as there is a range for normal weight or height for babies, there is a range of normal crying. The majority of infants who are labeled as colicky are not suffering a medical condition. They are simply normal infants who are fussy or cry more than most. So what if the baby cries a lot? If a baby is otherwise healthy, crying is unlikely to be a sign that something is wrong with the baby or with how you are taking care of the baby. In all babies, including fussy or colicky babies, the overall amount of crying will decrease by the 4th month of life. Long bouts of crying and inconsolable periods of crying are rare by the time the infant is 5 months of age. In most cases, the passage of time will remedy crying with no lasting harm to the baby. Even though the majority of crying is normal, it's important for you to trust your instincts if you're worried about how much a baby cries or if you think a baby is crying due to illness. In some cases, crying is a symptom of a health problem such as a short-term illness, with or without a fever, or a chronic problem such as an allergy or medical condition. If you suspect a baby is unwell, you need to talk to the parent or to a healthcare professional, depending on the situation. You may need to get help if you're having trouble coping with the baby's crying. The fact that excessive crying is usually normal doesn't make it easy to cope with. Infant crying, even when it's not labeled as colic, can be physically and emotionally draining for all caregivers, including professional childcare providers. These pictures show the same baby on the same day. In fact, these two pictures were taken just a few hours apart. This baby is healthy and normal in both pictures. Babies cry for many reasons, and there are many different things that you can try to do to calm the baby when they're crying. But what if your ideas don't work and you can't get the baby to stop crying? When a baby or a child can't stop crying, it is normal to feel frustrated. Although you may not be able to calm the baby, it's important that you stay calm. So what are some of the things that you can do to help to soothe a baby who's crying? You can try feeding the baby slowly, making sure you burp the baby often. Try to make the baby feel comfortable. Check their temperature, check their diaper. Provide a gentle motion or a relaxing sound for the baby. Check to see if the baby is thirsty or bored or anxious or sleepy. Understand that all babies have times when they cannot stop crying. So the baby will not stop crying and you're beginning to be frustrated or even angry. So ask yourself these questions. Is it okay to feel angry? What kind of changes happen to our bodies as our anger builds? What do you think happens to our ability to think clearly as our anger builds? Can people control their anger? Anger is an emotion that has a number of stages. You can take charge of your emotions and work through anger in a safe way at any of these stages before you boil over. Stage 1, pre-anger. This is the time before anger is triggered. Different people have different triggers. Stage 2, heating up. As anger begins to build, changes happen in our bodies and our ability to think clearly lessens. There's a great chance we may do something we will later regret. Stage 3, before boiling over. This stage refers to the few seconds before you lose your temper and strike out. Crying is an unpleasant sound, and it's normal to have strong feelings when we hear crying, particularly if we feel powerless to stop it. If a baby continually cries, even though you've done everything that you could to calm the baby, emotions like worry and frustration might build up to the point that you become angry. So the first step in the anger workout system is to accept your feelings so that you can start to deal with them. Then name the emotions that you have built up to the anger. Are you frustrated because you feel like nothing works? Are you afraid because you think something might be wrong with the baby? And then get your anger out. Put the baby in a safe place, like a crib. Leave the room and close the door. It won't hurt the baby to cry while you take a few minutes to step back and safely vent your anger and calm down. Energize yourself to feel calmer. Built-up anger takes time to subside, and adrenaline leaves the body slowly. Try self-calming strategies such as deep breathing, or try taking it out through positive self-talk or calling someone. Resume when you can return with a calm, cool manner. It's important to monitor the signals from your body, like your breathing and your muscle tension, and how you're feeling toward the baby. It may be that you may need to take another break, especially if the baby is still crying. A tired, frustrated child care provider and a crying baby can be a deadly combination, resulting in a caregiver shaking a baby in a moment of frustration. Situations like these can lead to shaken baby syndrome. Shaken baby syndrome is a term used to describe the serious injuries that can result if a baby is violently shaken. Violent shaking causes a baby's head to whip back and forth. This motion can cause blood vessels in the brain and eyes to tear and bleed. Compared to adults and older children, babies have fragile and underdeveloped brains. Babies' heads are heavy and their neck muscles are weak. This is why their heads require support whenever you pick them up or carry them. The younger the child, the more at risk they are because their brains and bodies haven't yet developed. Half of SBS victims are less than 6 months old. There are recorded cases of victims as young as 7 days and as old as 5 years. Although child abuse is difficult to talk about, you need to know that even a few seconds of shaking can cause a baby to have lasting brain damage or even die. Play activities such as being bounced on a knee or swinging in the infant seat do not cause this whiplash effect, nor do they cause the type of injury seen in shaken baby syndrome. Nevertheless, when doing any activities that cause jarring, be sure that the baby's head and neck are well supported. If you're not sure that an activity is safe for a baby, don't do it. This image shows how an infant's head moves when violently shaken. The shaking has its most serious effect on the brain because different parts of the brain move at different speeds in different directions. This can cause tearing or shearing of the different layers of the brain, resulting in damage to the brain cells. Characteristic injuries of SBS include bleeding in the space between the brain and the skull, swelling of the brain, and bleeding in the retinas in the back of the eyes. If you know or suspect that an infant or young child has been shaken, it's critical that you seek medical help immediately. Some of the early symptoms of shaking are irritability, lethargy or sleepiness, feeding problems, vomiting, dilated pupils, poor muscle tone, pale or blush skin, seizures, not breathing, or loss of consciousness. When an infant is shaken, the most serious effects is on the brain, but there are other physical signs that might accompany shaking. The most common are rib fractures, fractures to the long bones of the arms or legs, external wounds or bruises to the head. External head wounds will not be evident with most incidences of shaking. It is critical that you watch for and act on the less obvious signs of internal trauma to the brain. Responding to shaking is no different than dealing with other illnesses or accidents. It's important to have a clear plan in place before the emergency occurs and take action as soon as you notice something is wrong. It is much better to seek treatment too early than to wait too long. If you know or suspect that an infant or young child has been shaken, it is critical that you seek medical help immediately. As with any other emergency, contact the parents as soon as you can, but the first call must be to 911. If the child stops breathing before emergency help arrives, begin CPR. If the child is vomiting and you don't suspect spinal injury, turn his head to the side to prevent choking and aspiration. If you suspect a spinal injury, carefully roll the whole body to the side as one unit, while protecting the neck to prevent choking and aspiration. Do not pick up or shake the child. Shaking a baby can have extremely serious results. Depending on the study, research has found that 1/5 to 1/3 of the known victims of shaken baby syndrome die. Many SBS survivors have lifelong disabilities, such as blindness, paralysis, deafness, complications from broken bones, learning disabilities, coordination problems, developmental challenges, and seizures. Even babies who seem okay when they are released from the hospital may have problems later on, such as learning and attention difficulty in school. The most common reason given for shaking a baby is that the baby wouldn't stop crying. Other reasons for shaking include toileting mistakes, sleeping problems, and disobedience. Some babies are at greater risk of shaking than others. The primary risk factors are age. More than half of SBS victims are under 6 months of age. The younger the baby, the more likely he or she would be seriously injured if shaken. This is because younger babies are smaller. The size difference between the victim and the perpetrator can influence how much damage is done. Younger babies have proportionately larger heads and less developed neck muscles and brains than older babies. Gender. 60% of victims are boys. It is unknown why this is the case. Greater demands for care. Anything that makes an infant more difficult to care for, either temporarily or permanently, could make the infant more vulnerable to abuse. For example, preterm infants are generally more sensitive, harder to console, and may be less responsive to caregivers. Illness, short-term or chronic, can also make an infant more irritable and difficult to care for. Who would shake a baby? An SBS perpetrator is almost always the person who has been trusted with the baby's care. Anyone who looks after an infant is at risk of shaking, but research suggests the most perpetrators are under 25 years of age, male, usually the father or father figure to the infant, and that accounts for 60% or more of SBS cases. Female perpetrators tend to be babysitters, but some mothers have shaken their babies. People with other risk factors, such as people who have trouble controlling their anger, and drug and alcohol abusers are more likely to abuse a child. Mental illnesses can impact how well a person can manage the many demands of caring for a baby. People who don't understand normal infant behavior, such as normal crying, might think that the baby is purposely trying to annoy them. If a caregiver is highly stressed and can't cope, he or she may temporarily lose self-control and take out anger or frustration on the baby. When a baby cries, you can try different ways to soothe her. Different ideas may work at different times. Know that a comforted baby doesn't always mean a quiet baby. Your attempts to soothe the baby may not stop the baby from crying. The baby, however, is still benefiting from your attention. You're building the baby's trust and security in your relationship. Keep in mind that sometimes a baby just has to cry. Crying doesn't necessarily mean that something is wrong. When you have done everything that you can do to meet a baby's needs and the baby keeps crying, you may feel tired, alone, or frustrated. You might feel that you're not doing a good enough job, or that the baby is purposely making things hard. This is not the case. It is normal to have strong feelings in response to inconsolable crying. If at any time you start feeling tense, frustrated, or angry, it is important that you take a break. It is more important to stay calm than to stop the crying. If you are beginning to feel frustrated when you are caring for a baby who is crying, take a break. Put the baby in a safe place, like the crib. Shut the door and take 10 to 15 minutes break in another area close by. Use a timer to help you keep track of the time. Letting a baby cry for a few minutes will not hurt the baby. Once you are feeling calm, you can try again to soothe the baby. If you feel that you can't handle things calmly, you need to seek help. Call someone. Never have a baby in your hands when you are frustrated or angry. Not only is it okay to ask for help, sometimes it's the very best thing to do. All child care providers need help, and it's important for you to have a support system in place. Who can come over right away and help? A colleague? The baby's parent? A friend? Can you call the baby's doctor or nurse hotline? Are there local community resources that you can access? Remember, all babies cry. It's normal, and it's an important way for babies to communicate their needs. If you can't soothe the baby, remember that it's more important for you to stay calm than to stop the crying. Build a support system and plan ahead for who you will call when you need help. Share what you have learned about crying and SBS with your coworkers and with parents. If applicable, post crying and SBA prevention information in a place where staff and parents can see it. Remind everyone that babies cry, and that parents and child care providers should have a plan about how to deal with a crying baby and how to care for themselves. Please continue this course by reading through the materials that have been provided and complete the assignments that are also listed. If you should have any questions, feel free to contact me. Thank you for doing your part in preventing shaken baby syndrome in our community.